There are so many back pain tips out there that are just given out as a general thing. Oh, you got back pain with sitting? Use a lumbar roll under your lumbar spine when you're sitting. It'll increase the curvature and it'll support your back. Well, let's think about that. Does that actually make sense? If I'm suffering from excessive lumbar curvature, should I prop my spine into a place where it is forced into that problem? So let's talk about that. Let's talk about how muscular imbalances can cause back pain. They can lead to all of these different symptoms and diagnoses that we see here, like sciatica, radiculopathy, herniated disc, bulging disc, spondylolisthesis, stenosis. How does something like muscles being out of balance with each other actually lead to this? And so that's what I want to show. This is a picture of muscular balance. And we have pictured here the glutes. We have the abdominal corset that I love so much. We have the lower back muscles here. And we have the hip flexors. This would be the TFL. And this would be the rectus femoris. They're all in balance with each other here. And this is a squat. So this program I'm looking at right now is called Muscle and Motion. And they use the squat to assess postures. I'm going to play this and we're going to see imbalance. Okay, so now this is a typical pattern. The glutes are hypotonic. They've lightened to like a lighter, almost white color. Abdominals, hypotonic. Now we have dark purple here representing hypertonic, and the lower back muscles become hypertonic. So this is the forces being caused on the spine. Pelvis tips forward and is lifted up in the back. The belly bulges, and this is very, very related to a spondylolisthesis and stenosis particularly. So we saw those muscles, the hip flexors pulling tight, tipping the pelvis forward. We saw the lower back muscles tight that were lifting up on the back of the spine here. All of these forces are basically causing an increase in the curvature of the lumbar spine. And that's really what's happening. The lumbar spine is being pulled taut like a bowstring. It's getting bowed out because of tension in these lower back muscles here, getting tight right there. And the hip flexors also tipping the pelvis forward. And we're going to take a little bit more of a look at that as well. And so another thing that happens is the angle of the sacrum changes. So this would be a normal angle, 40 degrees. It's a normal angle. When we go into lordosis, because of those tight lower back muscles, because the pelvis is getting tipped forward, that angle also tips forward and it goes higher than 40 degrees. And this is going to cause conditions in the lower back. And so if you imagine, so we have the pelvis tipped forward, the sacrum tipped forward, we have forces bowing the lumbar spine forward. All it takes is for one of these segments to break down. And instead of bowing like a uniform bow, it starts to kink. And that's what we call spondylolisthesis. The force actually breaks down one of the segments and it starts to slide forward instead. You can see that the space between the vertebrae is getting closed down. It's going to compress more on the back of the discs, which will cause things like herniations or bulges. It's also going to close down the space just in general where nerves come out, which we call stenosis. This is a great way to compress nerve roots. There's nerve roots. And if we compress the back of the vertebrae through our posture, you're going to see it right here. Those nerve roots are going to get compressed. So the question you're asking is, can you open up your posture? Can you reduce the amount of curvature in the lumbar spine? Because if you did that, then as we just saw, the spaces between the vertebrae can restore. These are forces happening at the lumbar spine, but if we look at what we have as a tool, we have a wall. This is actually the abdominal wall, and walls block things. So getting more engagement in the abdominal wall, instead of having this, a total breakdown in the abdominal wall that allows things to slide forward, we learn how to engage that abdominal wall and prevent that, then we are just using physics back in our favor. And so, yes, you can restore posture and take pressure off of nerve roots, which is radiculopathy. We're going to look at now kyphosis, the kyphotic posture, which is the upper back posture. So part of these muscle imbalances is kyphosis, which is the forward curvature of the upper back. And that's from tight muscles. The chest muscles tighten up and pull the shoulders forward when we have too much of this going on. This is us going into kyphosis. And that forward head, rounded spine posture is going to require, especially in certain motions like the squat, even for some people just standing and walking, it's going to require that the lower back go even further into an arch. It's kind of as if somebody is always bent forward in their upper back. So if you're always flexed forward in your upper back like this, then the correction so that you can look forward, so that you're not looking at the ground, so you're not always bent forward completely, the correction happens down below and also in your neck. This is a nice lumbar curvature here, but you're having to correct an arch in the lumbar spine to look forward. So if we can correct this hyperkyphosis, it allows for the lumbar spine to correct and be more in a neutral position and not so much causing all of those conditions that we talked about before. The end goal, what do we want to actually accomplish with all of this? It's to stabilize that lumbar spine, so it's not having to arch and bow so much, and it's being supported by the muscles around it, and mobilize the joints above the thoracic spine, so the thoracic spine can do some of the extension and the lumbar spine doesn't have to, and the hips, so that the hips can do most of the motion that we need for mobility, and the motion doesn't have to go into the lumbar spine. So we want to use these abdominal muscles to engage and bring that rib cage back. What happens when we're bringing that rib cage back? It actually is correcting this hyperlordotic curve. We're increasing the tension, neuromuscular tension in these muscles, which is going to help restore balance all around, because the lower back muscles will be reciprocally inhibited through that. How do our muscles get shaped? The way that we use our bodies shapes our bodies. And so if we are sitting a lot, our body's going to be shaped like a sitting position, which is the fetal position. Fetal position tightens hip flexors. Hip flexors pull on pelvis. Pelvis rotates anteriorly. Lumbar angle increases beyond 40 degrees. Lumbar spine becomes bowed, causes anterior forces that cause things like spondylolisthesis. Or maybe it was a herniated disc that you get cut out. Regardless of treating the symptoms, we still need to address the root cause so that it doesn't happen again, so that we can address the actual problem that caused it in the first place. And the way that we use our bodies is the farthest upstream thing we can do. Use your body in a healthier way. Can't do that yet? Get down on the floor and do some really gentle engagement stuff and spend a lot of time doing that. Using the floor to help align our spine and engage those muscles that predictably tend to become hypotonic, those abdominal muscles. The bridge is another great thing, and maybe you'll be able to get up and do some walking. And if you can get up and do some walking, at that point, that's a major breakthrough. You can use walking as a muscular balancing tool because walking itself is one of the best tools for restoring balance in the body. It's going to naturally restore balance in abdominals, the glutes, the lower back muscle, and the hip flexors. It's the most synergistic motion that the body does. So you want to get to the point of walking. And then once you can walk without pain, you want to use walking as a tool to continue to restore muscular balance. You could walk an hour or more every day. It would be only beneficial to your lumbar spine if you can get to the point of muscular balance enough so that walking doesn't hurt, so that you can stand up straight without putting too much pressure on a nerve. We got to get to that point. And so using the floor initially is the way to do that. I think it is really important to just understand the anatomy to the point where you can connect the dots between the forces that are at play so that the result that you come home from the doctor with, which is a diagnosis, doesn't feel like it's so abstract and just where did it come from? Well, it came from forces like this. It came from physics. And physics makes sense. And if it doesn't make sense, don't do it. I 100% believe it is absolutely possible to take an instability, which is just the forward movement of a vertebrae. We know that it's movable, right? This should make sense because it's moving, to move it back in the opposite direction. I could do that right now in a short-term way by laying over a pillow over my abdomen and put that pillow pressure right underneath the spondy location. And the force of that pillow is going to push the vertebrae. So that's a short-term relief method that I would recommend, but you lay on a pillow long enough and you use your abdominals as a blocker to pull that back in. So this would be flat back, less than 40-degree curvature, which in my opinion would be helpful to someone who has spondylolisthesis. That would be my goal. And actually has been my goal. As someone who has a history of spondylolisthesis, I want to reduce those forces that are trying to bow my spine forward or pull it forward, from those hip flexors pulling it forward, those lower back muscles bowing it forward. I want to reduce those forces and I want to move towards a flat back posture because then there's less reason for my spine to slide forward. And so that would be my recommendation, is to look at it this way. This is biomechanics. This is physics. And if we are going to take advantage of our knowledge of physics, we want to reduce the forces that are pulling the spine in those directions. And so if we reverse engineer the problem and do everything that led to that problem, do it in reverse and try and restore where you came from, we can get some of that, if not all of that function back into a healthy place. Appreciate you all showing up and leaning into your health. Just makes me want to lean back even further. So I'll see you again next week. And until then, make sure you get down on that floor and connect to your core.